Hey everybody, this is Dr. Adam Rindy speaking with you today about secondary outcomes for chronic illness. Primary outcomes usually are when a therapy or a practitioner or a research study is looking essentially to reverse or cure the disease. And secondary outcomes are mainly associated with those symptoms in a chronic illness that impact the quality of life. For example, fatigue. So you could have a chronic illness such as ulcerative colitis, and let's say the bowels are stable, but there is fatigue associated with the illness or associated with the medications that you're taking or associated with just coming off of medications such as prednisone. And so a secondary outcome is fatigue. This is often overlooked because people who are not experiencing the illness might just be focused generally on the primary outcome. And what I'm speaking with you today is the importance of the secondary outcome. So secondary outcomes could be anything from I was able to go for a walk with my family today. I reached a good secondary outcome. Or I was able to sleep through the night or sleep half the night without awakening in pain. That's a secondary outcome. Other things could be, such as I was able to experience an appetite. My appetite was better today, and another outcome could be my weight is stable. These are all things that often get overlooked because the psychology of illness is generally thought of in a lot of circles is, that we have to kind of cure or fix the illness in order for us to be achieving anything. And I'm trying to really put forward a strong message about the importance of focusing on secondary outcomes. As the disease is taking its course or the process of the illness is taking its course, there are things that we can work on as patients and as practitioners that can have very favorable impact on someone's life. So let's take gut health, for example. Someone with Crohn's or colitis might be experiencing irregular bowel movements when they're not flaring, or they might be experiencing bloating or gas or distension when they're not flaring. And if we were able to improve that, then perhaps it could really be a secondary outcome that would really improve the quality of life and perhaps improve the quality of the management of the illness. Another thing is like a chronic illness like depression or anxiety. Secondary outcomes might be, in a given day that you had energy to go out and exercise, and focusing on building up energy stores and supporting systems like the adrenal glands or the mitochondria to help with the secondary outcome of being able to have energy to do things that are day-to-day function that a lot of people just take for granted. Now, one of the nice things about focusing on secondary outcomes is that these are more manageable sometimes and more in our control. And also it can give us a sense of achievement and accomplishment in our journey towards hopefully getting a hold of an illness or reversing it, and at the best, curing it. I think it's very dangerous and a slippery slope when you meet a practitioner that tells you if you have a chronic illness that they're going to cure your illness, because they're highly focused on the primary outcome. And as we know, anybody who's dealt with a chronic illness, a lot of things are out of our control. Secondary outcomes, however, could potentially lead to a happier life, a more fulfilling life, a life that has better health and wellness. And so I'm encouraging us all to take a step back and come up with a list of secondary outcomes that we're looking for in chronic illness. The one thing that I use in my practice is the Metabolic screening questionnaire, and it's a really good questionnaire that helps people get an overall assessment of their overall health, from digestion to sleep to mental health to detoxification to skin health. All of these things that could look at and are impacting the totality of someone's well-being and someone's health. So with that, I will post a link below of this video of my metabolic screening questionnaire. It's actually not mine. I actually adapted it from various conferences and documents that the Institute of Functional Medicine put out, and it's been really helpful as a checkpoint and other aspects of health that we can focus when we're on the journey of dealing with chronic illness. So people who are in between rounds of cancer treatment, they can think about this. If people are in and out of infusions for autoimmune diseases, they can be thinking about these things. These are just really, really important aspects of health that I really want for my patients and for my loved ones to consider in the totality of health and wellness. So with that, thank you for tuning in, and if you have any questions, feel free to message below.